You look in the mirror. You see it right away. The white part of your eye is no longer white, it's pink, or even a startling shade of red. This is a common experience for millions of people. We call it red eye, but the medical term is more complex. It happens when the tiny, delicate blood vessels on the surface of your eye become swollen and dilated. This makes them much more visible, changing the eye's appearance. It can be a concerning sight, one that makes you wonder if something is seriously wrong. While red eye can look alarming, the cause is often benign. Many cases are temporary and resolve on their own with little intervention. Think of it as a signal your body is sending. Your eye is reacting to something in its environment, or within your system. The redness is simply a physical manifestation of that reaction. It's a sign of inflammation or irritation. Understanding the potential causes is the first step toward finding the right solution and gaining peace of mind. Let's start with one of the most frequent causes: allergies. Your body's immune system can overreact to harmless substances. These are called allergens: pollen in the air, dust mites in your home, dander from a pet. When these particles contact your eyes, they can release histamine. That causes blood vessels to swell, leading to redness. Allergic red eye is often accompanied by intense itching, a burning sensation, excessive watering. Typically, both eyes are affected at the same time. Another major category is infection. The most well-known: conjunctivitis, pink eye, inflammation of the conjunctiva, the thin membrane over the eyeball and inner eyelid. It can be caused by a virus or by bacteria. Viral conjunctivitis often comes with a common cold and watery discharge. Bacterial conjunctivitis produces a thick, yellow or greenish discharge. That discharge can make your eyelids sticky or crusted shut in the morning. Simple irritation is another common source of redness. Smoke, heavy winds, dust, chlorine in a swimming pool. Rubbing your eyes too hard can also cause temporary redness and discomfort. Contact lens issues, improper cleaning, overwear, or a poor fit. A tiny scratch on the cornea can cause significant pain, light sensitivity, and a very red appearance. Finally, dry eye. When your eyes don't produce enough tears to stay lubricated, or when tears evaporate too quickly. That lack of moisture leads to friction and inflammation, which causes redness and a tired, gritty feeling. Many factors contribute to dry eye. Staring at screens reduces blink rate and leads to dryness. Certain medications, age, some medical conditions, making red, dry eyes chronic for many people. The goal here is clarity. We want to provide you with the information you need to make a calm, rational decision about your health. For many of the milder cases of red eye, simple home care can provide significant relief. It's about addressing the source of the irritation and soothing the symptoms. If you suspect allergies are the culprit, the approach is twofold. First, try to avoid the allergen if possible. Second, use targeted treatments. A cool, damp cloth placed over your closed eyes can reduce swelling and ease the itching sensation. Over-the-counter antihistamine eye drops are specifically designed to block the body's allergic response, providing fast and effective relief from redness and discomfort. Always follow the package directions. When irritation is the cause, the goal is to flush out the irritant and allow the eye to heal. If you get smoke or dust in your eye, gently rinsing it with clean, lukewarm water or a sterile saline solution can wash away the offending particles. It is absolutely essential to stop wearing your contact lenses if they are causing irritation. Continuing to wear them can worsen the problem or even lead to a more serious infection. Give your eyes a break until all redness and discomfort have completely subsided, and it bears repeating. Avoid rubbing your eyes. This action almost always makes the inflammation worse. For mild viral conjunctivitis, which often resolves on its own like a common cold, good hygiene is paramount. This type of infection is highly contagious. You must wash your hands frequently with soap and water, especially after touching your eyes. Do not share towels. Do not share pillowcases. Do not share eye makeup. While there is no cure for the virus, you can manage the symptoms. Using a clean, warm compress can help soothe the eye and gently loosen any crust that may have formed along the lash line. Lubrication is key for managing the redness associated with dry eye. While home care is often sufficient, there are specific symptoms that should be treated as urgent warning signs. These are not situations for a wait-and-see approach. Severe eye pain is a major red flag. This is not the mild scratchiness of dry eye or allergies. This is a deep, intense, throbbing pain that signals a potentially serious underlying problem, such as acute glaucoma inflammation inside the eye. If you experience this level of pain, you must seek immediate medical attention from a doctor or an ophthalmologist. Another critical warning sign is any change in your vision. Blurred vision, double vision, seeing halos around lights, it is a cause for serious concern. Your eyesight should not be compromised by a simple irritation. Such symptoms could indicate a dangerous infection and injury to the cornea, a sudden increase in eye pressure. Similarly, extreme sensitivity to light, a condition known as photophobia, is not normal. If you find yourself unable to tolerate normal indoor lighting, it's a clear signal that something more serious is happening within your eye. You must also take immediate action in the case of a physical or chemical injury. If a foreign object, like a piece of metal or glass, becomes embedded in your eye, do not attempt to remove it yourself. Cover the eye and go to an emergency room. The same urgency applies to a chemical splash. Immediately flush the eye with clean water for at least 15 minutes, and then seek emergency medical care. These are time-sensitive situations where a delay in treatment can have permanent consequences for your vision. The takeaway here is clear. Red eye can be simple, but it can also be a sign of a sight-threatening emergency. Do not ignore the danger signs we've discussed: severe pain, changes in vision, extreme light sensitivity, or significant injury. If your symptoms are severe, or if a mild case of red eye does not begin to improve after a few days of home care, it is time to get a professional opinion. Your vision is too important to leave to chance. The clear next step is to make an appointment with your doctor or an eye care specialist. Get the facts, get a diagnosis, and get the right treatment.